Hi, I'm Kertesz. I'm a medical doctor and a researcher on homelessness. Tonight, as the sun sets, we know that there are people who are going to be sleeping out there on the streets of Birmingham, just like every other city in America. That's a very tough situation for the people who are out there, and it's also a topic that excites a lot of polarization in our public discussion. Sometimes our opinion leaders can get so frustrated that they can wind up effectively trolling the American people with incredibly simplistic assessments. Just 2 years ago on Fox News, Tucker Carlson and Chris Rufo sat down and determined that unsheltered homelessness was best considered an addiction problem. Well, I'm an addiction doctor, and I can say that sometimes that really is part of why somebody winds up on the streets. But just because you can polarize a topic for the American people, that doesn't mean you have to. So our research team asked if we could put together evidence to try to account for who winds up homeless and on the streets at the same time. And we did it with survey data. With generous support from the U.S. Department of Veterans Affairs, we collected surveys from over 5,000 veterans who had spent at least some time homeless in the 2.5 years before the survey. We asked them if at any time in the 6 months before the survey they'd been unsheltered, on the streets, or in bus stations for 7 days or more. 481 of them, about 9%, said yes, they had been. With our data, we then asked which personal and community characteristics best predicted who would have been unsheltered in that group. Was it just addiction, as Chris Rufo and Tucker Carlson said, or was it community characteristics like the rents or the lack of shelter beds, or something else entirely? And what we found was pretty interesting. There were actually 9 personal risk factors and 2 community characteristics that all predicted, to a degree, who would wind up without shelter. They range from being poor or having a criminal record, to having poor health, to lack of social support, to having a drug problem, although not an alcohol problem. Similarly, the 2 community characteristics included being in a community with warmer weather or having a lack of shelter beds. Go figure. But here's the key. Each one of those risk factors added moderately to the chance of a person having been unsheltered, about 10% to 50%. And they stacked together. The more risk factors a person had, the more likely they were to have been out there, unsheltered, on the streets in the 6 months before the survey. And then we took a look at rents across the 26 communities where we collected surveys. We asked, in effect, does having 5 vulnerabilities matter the same if you're in a place with low rents compared to a place with high rents? And the answer was no. The rents make a big difference. Having those vulnerabilities in a place with higher rents greatly increased your chance of having been without a place to stay, unsheltered, on the streets, compared to having the same vulnerabilities in a place with low rents. That's called an interaction effect. So here's my take on our data. Let's depolarize the homeless discussion by using evidence. Yes, personal vulnerabilities count in understanding who is going to wind up unsheltered. But it's not just one vulnerability like addiction, it's a stack of vulnerabilities. And the more you have, the greater the chance you'll be without a place to stay. Some of those things that we call personal vulnerabilities are having a criminal record or not having money. And those are actually things that we can fix partly through our community policies and the kinds of assistance we offer. And it's not just the personal vulnerabilities, it's the communities we live in that affect whether a person is likely to be without a shelter. So yeah, community factors like lack of shelter beds, warm weather, and rent, those also contribute to your chance of being unsheltered. That means we have some room to make a difference. Now this is the point where I need to tell you that my opinion does not reflect an official position of the U.S. Department of Veterans Affairs. But let me close up by saying this. We can make a difference in some of those community factors that drive unsheltered homelessness. We may not be able to change the weather, we might be able to do something about the rent and about shelter beds. Thanks.